Good day everyone, we are from Group 5 with Michael Ghiffary Andreano, Almayda Mustario, and Samuel Rajawali Sianturi. And today, we would like to talk about Cryptococcus neoformans. So what is Cryptococcus neoformans? Cryptococcus neoformans is an encapsulated Basidomycetes yeast belonging to the class Tremelomycetes and an obligate aerobe that can live in both plants and animals. Interesting, isn't it? So, to know more, let's watch the video. Cryptococcus neoformans is characterized by its global distribution and significant impact, especially among immunocompromised individuals. Annually, approximately 1 million cases of cryptococcuses occur worldwide, resulting in about 625,000 deaths. And it's a research by Manda 2023. Cryptococcal meningitis, CM, is a severe form of cryptococcuses, causing an estimated 181,000 deaths each year globally. The infection predominantly affects immunocompromised patients, especially those with HIV/AIDS. In HIV/AIDS patients, cryptococcal fungemia prevalence ranges from 27% to 71% depending on the population studied. Besides HIV/AIDS, other underlying conditions such as diabetes, hypertension, liver disorders, tuberculosis, malignancies, and organ transplants increases susceptibility to Cryptococcus neoformans infection. Some cases can occur in immunocompetent individuals, although it is less frequent. Let's look at the microscopic morphology, shall we? So, for its shape and size, Cryptococcus neoformans cells are typically round to oval, measuring approximately 4 to 6 micrometer in diameter, though they can range from 2.5 to 10 micrometer depending on the environmental conditions. What about the budding? The yeast reproduces by narrow-based budding, where a smaller daughter cell emerges from the parent cell and eventually separates. For the capsule, a prominent feature is its thick polysaccharide capsule, which can be up to 30 micrometers thick. This capsule appears as a clear halo around the cell when viewed under a microscope, making it a key to a diagnostic indicator.
Cryptococcus neoformans can grow on various culture media, each showing unique characteristics. On Saburat dextrose agar or SDA, colonies appear smooth, creamy, moist, and slightly mucoid. On Stape agar, colonies turn dark brown to black due to melanin production from phenolic compounds. This melanin helps differentiate Cryptococcus from other fungi such as Candida albicans. Similarly, in tobacco agar, colonies develop a dark brown color, confirming phenol oxidase activity. On methyl-dopa agar, melanin production is again visible, turning the colonies brown. The characteristics of cultural growth for Cryptococcus neoformans can be seen on the following table. First, on Saburat dextrose agar, colonies grow smooth, creamy, and mucoid. They appear white to beige without any pigmentation. Growth usually takes 2 to 5 days at temperatures between 25 to 37 degrees Celsius. Next, on Stape agar, also known as niggerseed agar, colonies use caffeic acid as a substrate. Here, Cryptococcus neoformans can be distinguished from other yeast. The colonies turn brown to black due to melanin production. Moving on to methyl-dopa medium, it detects phenol oxidase activity, confirming the presence of melanin. Colonies again appear brown to black. And finally, on tobacco agar, we assess capsule expression and phenotype switching. Colony variations in size and texture are seen, and the growth appears pigmented. In the defense system of Cryptococcus neoformans, the capsule plays a vital role, and the heart of this capsule is something called GXM, or glucuronoxylomanan. GXM is the primary antigenic component. Its structure varies between stereotypes, such as A and D, making it a potential but challenging target for vaccine development. The foundation of GXM is a menin backbone, decorated with side chains of beta-D-glucuronic acid and beta-D-xylose, forming hydrophilic fringes, while mannose-6O acetylation creates a hydrophobic ridge critical for antibody binding. Through this intricate design, Cryptococcus neoformans shields itself against immune attacks. But how does it actually cause infection?
First, the entry into the host through inhalation of spores or desiccate T cells is the primary route of the infection. And in immunocompetent individuals, the infection may remain asymptomatic or localized in the lungs. And they survive in the lungs. Cryptococcus neoformans evade the immune system by surviving inside the alveolar macrophages, resisting phagocytosis due to its thick polysaccharide capsule. And in immunocompromised hosts, the fungus can proliferate and persist, forming a granuloma-like lesions or pneumonia. Next, there is the dissemination. From the lungs, the fungus enters the bloodstream and can disseminate to other organs. The most common and severe site of dissemination is the central nervous system or the CNS, leading to cryptococcal meningoencephalitis. Next is the crossing the blood-brain barrier. Cryptococcus neoformans uses 3 mechanisms to cross the blood-brain barrier. First, they use the transcytosis. Yeast cells are taken up by endothelial cells and transported across. And then there is the paracellular traversal, disruption of tight junctions between endothelial cells. And last but not least, there is the Trojan horse mechanism by hijacking of infected macrophages that cross the blood-brain barrier. And then we have the immune evasion. The fungus modulates host immunity, often suppressing effective T-cell responses. It alters cytokine profiles to shift away from protective Th1 type responses.
Cryptococcus neoformans can cause various diseases, depending on the site of infection and the immune status of the host. The most serious condition is cryptococcal meningitis, especially in immunocompromised individuals. Symptoms may include headache, fever, vomiting, neck stiffness, and altered mental status. In the lungs, it can cause pulmonary cryptococcosis, with symptoms such as coughing, chest pain, and difficulty breathing. In healthy individuals, the infection might be mild or go unnoticed, but it can be severe in those with weakened immunity. The last is cutaneous cryptococcosis, where the fungus infects the skin. It usually appears as skin lesions or nodules. Hence, it is important for us to early detect the infection of Cryptococcus neoformans, especially in immunocompromised patients.
Diagnosing cryptococcosis has become easier over the years thanks to various effective methods. The traditional approach includes examining body fluids using India ink, histopathology with special stains, culture of samples, and serological tests to detect the cryptococcal capsule. One of the most accurate tools is the antigen test using techniques like latex agglutination or ELISA, which can detect cryptococcal polysaccharides in blood or spinal fluid over 90% accuracy. More recently, a cheaper, faster, and field-friendly method called the lateral flow assay has been introduced. However, diagnosis still depends heavily on the doctor's awareness. Without considering risk factors like HIV or organ transplants, early detection can be delayed, leading to worse outcomes. Treating a Cryptococcus neoformans infection requires a careful, multi-phase approach tailored to the patient's immune system. The first goal is to reduce the fungal burden, especially in the central nervous system. First-line therapy includes liposomal amphotericin B or amphotericin B deoxycholate combined with 5-fluoxetocin. These potent drugs aim to quickly eliminate the fungus from the body, especially in serious cases of cryptococcal meningoencephalitis. Once the infection is under control, the next step is fluconazole, which helps suppress any remaining fungal cells and prevents relapse. After initial treatment, patients continue fluconazole at a lower dose for long-term suppression of fungal growth, especially in immunocompromised patients. For those with HIV/AIDS, therapy may need to be adjusted. ART should be deferred initially to reduce the risk of immune reconstitution inflammatory syndrome, or IRIS. In organ transplant patients, immunosuppressive therapy must be carefully balanced. Overall, treating Cryptococcus neoformans is challenging, requiring careful therapy, monitoring, and adjustments based on individual health and conditions. Preventing Cryptococcus neoformans infection starts with environmental control. This fungus is commonly acquired through inhaling spores from bird droppings, soil, or decaying wood. High-risk individuals, especially those with weakened immune systems, should avoid areas where these spores are present, such as construction sites or places with heavy bird activity. For those with compromised immunity, such as people with HIV, early detection is crucial. Regular testing for cryptococcal antigens can help identify the infection before it becomes life-threatening. By detecting the infection early, we can start preemptive treatment, preventing it from progressing to more severe conditions like meningitis. For HIV patients or those with weakened immunity, taking fluconazole as a preventive treatment can stop the infection before it becomes invasive. Public health interventions play a key role in preventing cryptococcosis. Educating healthcare providers and at-risk populations about early signs of infection can improve early diagnosis. Raising awareness ensures that individuals are tested and treated in time. Preventing Cryptococcus neoformans infection requires a multifaceted approach, avoiding exposure, early detection through antigen testing, and prompt treatment.
Through these strategies that we've already discussed, we hope that you're able to prevent Cryptococcus neoformans infections in the future.
Alright everyone, that is enough from us. We apologize if there are any mistakes or any information that are missing from our explanation. Thank you so much for watching this video. Have a great day everyone.